pandemic. I'm really proud of all of you, and I think we have 12 and 13-year-olds here, so that's really wonderful. So Shanti, I'm going to try to share my screen next.
Okay.
So share screen. To go to, I think I'm on the last slide, sorry. Okay. Full slideshow. Okay, is it good?
Yes.
And can you hear me well? Everything
Yes.
is good? Okay.
Everything is perfect.
Okay, Shanti, Dr. Shanti just gave a wonderful introduction. So I don't have to say anything more. I'm a pediatric neurologist with additional expertise in autism and neurodevelopmental disorders. So I basically work with special needs kids. And I'm based here in Frisco, but I also have offices in Arlington, Plano, and Richardson as well. So COVID-19, how has it impacted the children, all children, but also more so the kids who have special needs, specifically the kids on the spectrum, autism spectrum. So we are doing a lot of homeschooling and virtual education. Is that good? Is that bad? Of course, there are some pros. Maybe the child gets to stay home, wake up late, and no dropping to school and all that. But the challenge is, hey, it can cause a lot of behavioral problems. You're stuck at home. You're stuck in front of the computer. The parents had to spare time. It's depressing because you're not able to see your peers or play with other children. And even for the teacher to do homeschooling or virtual education, it's so different from face-to-face, and specifically about autism, where you have to do one-to-one, where you need that direct attention or direct coaching is missing. Virtual versus live therapies. In my experience, at least for children on the spectrum, autism spectrum, and special needs kids, I think live therapies are beneficial. A lot of these children with special needs just not go to school. They get speech therapy, they get physical therapy, they get occupational therapy. So how can you do this just staying at home online, like a speech therapist or a behavioral therapist talks to you on the computer? And can the child with autism grasp that? It's just so difficult. So this is a huge impact on the kids. They're not getting therapies, and this might cause some regression and have them go downhill. And this is a term, it's not just for special needs kids, COVID-19 depression. I was just telling Shanti earlier that we have a diagnosis now since March, whenever COVID started. So COVID-19 itself, staying at home itself, is causing depression in a lot of preteens and teens, which is really sad. So I think obviously seeking out help, talking to your parents, talking to your teachers, talking to your peers, or getting appropriate psychological therapy to overcome this anxiety, depression, and other psychological stressors is very, very important. Okay, so now let me switch gears and speak a little bit about sleep hygiene as well, which is impacted in children with autism. For example, the children are sleeping late. Children with autism spectrum and special needs kids have sleep issues in general, 30 to 40% of them. And on top of it, now being at home, sleeping late, and all that can have additional impact. So that's a huge concern. The sleep hygiene in itself is impaired. On top of it, with the COVID-19 pandemic, it's affected more and more. We use melatonin in kids, and that's kind of helpful in children with the autism spectrum. But in general, I think it's natural. I want to stress the fact it is a natural medication. It's over the counter, and you can use it as needed, and it helps the brain produce the melatonin when the natural melatonin is missing from the system. This slide, I would like to focus on impact on parents and caregivers. How does this huge pandemic, the COVID-19 pandemic, affect parents? A lot of parents in general with the pandemic, they have lost jobs or they have got laid off. So it's affected them financially already. On top of it, with the lockdown, they have to stay at home with the kids. Say they have a job where they have to be present at the job, but they cannot because they have a special needs kid who they need to take care of. So there's a financial constraint there. And okay, you're allowed to work from home, but you have a kid who has special needs, so you just cannot let him stay in front of the computer on Zoom and have him deal with his classes. The parent, there has to be parental assistance, and most parents are functioning as teachers for the special need kids. So it's double or three times the burden what normal kids are facing, and the effect on parents and caregivers in general. A lot of home support, the routine is changed, and if there is a single parent, that's more challenging again. So this quarantine and lockdown has affected parents and caregivers in a wide variety of ways. This is the last slide, effect of media and gadgets. All of us are affected in general. And now with the COVID-19 pandemic, staying at home, it's all gadgets, gadgets, gadgets. So of course, on teenagers, there is a lot of distraction. Hey, are you on Zoom, or are you doing something on Facebook or WhatsApp or whatnot? Or are you watching YouTube videos, playing video games? You can't go outdoor and to a park and play with other children. So just play video games and whatnot. So it's definitely impacted. It's been at least 5 to 7 hours a day. Most kids, whether it be special needs or not special needs, are spending in front of the computer, phones, and other gadgets. And obviously, in terms of medically, it's also affecting vision. It's causing strabismus or squinting of the eyes. It's causing vision problems. A lot of kids who never wore glasses are having vision issues and are needing to see an eye doctor and get glasses, all because of the gadgets and the side effects of gadgets is what I would say. That's brief. And Shanti, I think we are holding on to the questions until the end, right?
Yes.
Okay, I will stop here and you guys can continue. Thank you again. Thanks.
Yeah, before you conclude your talk, I would like you to give some, not really advice, but your suggestions to the audience who are mainly, youth of the USA. So how would you, guide them? Because COVID is not going away. It is what it is. We have to accept, adapt, and move on. And this is what I'm telling all the parents and the children who come to my practice. In fact, I am promoting exercise, so I have like 5 tips. This is what I share. The first thing is sticking to your routine every day, at least Monday through Friday. And next is the healthy diet. Make sure your immune system is strong. And thanks to the US government, the doctors are like vaccinated, the healthcare and the frontline workers. So we are going to get the second dose soon, and then the general public will get the shots. Hopefully by summer, all of us should get vaccinated. So, and the next one is having a good sleep hygiene. So I want to reinforce, what Dr. Golla mentioned already. And also I'm promoting yoga and meditation. So in this, uncertain times, even healthcare professionals, we don't know anything about what's going to happen because it's like a novel virus and no one has a clue, including the researchers. So we can have some predictions, we have some statistics, but we don't know what exactly is going to happen. We have to prepare ourselves for the next 2 years. Because COVID will take at least next 2 years, to go away. Once we have the so-called herd immunity, we have to have 70% of this world, either get infected or get the passive immunity through the vaccination, and then life will be normal. This is the new normal for the next few years. So how would you help quote normal children, the ones who are going to graduate soon, going to college, things like that, to reduce, because 50% of the children feel very anxious and they're all feeling depressed and hopeless. So we need your guidance, please.
Exactly. Like I mentioned, I think anxiety and depression has become much, much worse, especially in the teenagers. It's affecting teenagers a lot. I'm not just talking about special needs kids, it's just children in general, teenagers, and of course, adults. We are depressed too. So seek help, talk to people, whether it be Zoom or meeting people, as far as you maintain social distancing and all the guidelines. I think it is okay to meet a friend in the backyard or with precautions. If you feel anxious, if you feel like down, if you feel like restless, sleepless, just speak out, talk to someone. Maybe it can be a parent or it can be a good friend, but do not keep it inside. Okay, that's my biggest advice to our youth. And most youth, like they tend to like, okay, I'm feeling bad, I'll just suck it up, or whatever. So just try to get advice, speak to whoever you trust. Be careful when you discuss to strangers on social media. Just don't talk to those weird groups there. Hey, I'm depressed, I feel anxious. Talk to a person you know, or trust, or even to your teacher. It could be a teacher. And there are a lot of online services available, and a lot of free services for students, especially to get over this anxiety and depression of staying alone. But again, please follow the social distancing guidelines, whether it be mask or nothing has changed since March. So we still need to do those social distancing stuff. And of course, Shanti, you can share my information with any youth who are interested, and they can contact me or reach out to me personally as well.
Sure, absolutely. Do you want to go to your last slide?